Good afternoon, everyone, and thank you for joining us here today. I'm Dr. Derek Robinson, and I'd like to start off my comments this morning with a personal story as an emergency medicine physician, as a husband, a father, and as a son. Last summer, my wife, who is a local Chicago pediatrician, and I decided to allow our two sons to participate in a COVID-19 clinical trial for a COVID-19 vaccine. We had seen up front how COVID-19 had impacted our patients, members of our community. I personally lost my godfather early during the pandemic to COVID-19, and he actually did not have access to a COVID-19 vaccine. As parents and doctors, we were vaccinated, but we also knew that the benefits of the vaccine far outweighed any concerns that some individuals have regarding vaccinations. Our boys were really proud of their efforts to help make vaccines available to more young people, and we were really proud of them for taking that important step. I share this personal story because I do believe that we can win the fight against COVID-19, but I think we all have to do our part. And as part of the reason why I'm excited to be here today as Chief Medical Officer at Blue Cross and Blue Shield of Illinois, here at our Blue Door Neighborhood Center, as we discuss the Centers for Disease Control and Prevention's recent authorization of the COVID-19 vaccine for children from the ages of 6 months to 5 years. Many parents across the city of Chicago and across America have been waiting for this opportunity. We're gathered at one of our Blue Door neighborhood centers that are operated by Blue Cross and Blue Shield of Illinois. And in addition to centers that we have in Pullman and South Lawndale, this center serves the Morgan Park area and provides health and wellness education resources, community gatherings, and also healthy food choices. We're really pleased to make this site available for vaccinations today, and we look forward to using some of our other sites for vaccinations in the near future in partnership with the Chicago Department of Public Health. We do advise that parents who have questions about COVID-19 vaccines talk with their doctors or their child's pediatrician. Our goal at Blue Cross and Blue Shield of Illinois is to make sure that those who want to get their children vaccinated have the opportunity to do so. Now, we're also honored to have a number of guests here with us today. I have the distinct honor of introducing a fellow physician who I referred to as Superwoman earlier. She's someone that's no stranger to this audience. She has been a sounding board and a really steady voice to us during some very difficult times. You know her as the Commissioner of the Chicago Department of Public Health. Please join me in welcoming Dr. Allison Arwady to this podium.
Thank you so much, Dr. Robinson. It is such a pleasure. It's my first time to be at one of the Blue Cross Blue Shield Blue Door locations, and I love being down in Morgan Park and seeing the beautiful space that is used for health education and is being used to make sure that people have the information and can access vaccines. I know there were a lot of you in Chicago who were excited when finally we got the authorization to start vaccinating our youngest Chicagoans. Vaccines against COVID are now available for children over the age of 6 months, and they are available to everybody in the city of Chicago free of charge. If you want to get more information about where you can get vaccinated in Chicago, we always encourage you to go to chicago.gov/under5vax. That's UNDER, the number 5 VAX. Your first call should be to your pediatrician or your family doctor because our preference is that you get vaccinated in the setting that your child is comfortable with, and so your providers can make sure that you're up to date with all of the other things that we do to keep kids healthy. I am a pediatrician by training. I absolutely trust vaccines. I want you to know that my youngest nephew, who was the only one in my extended family who had not been old enough to get vaccinated, got his first dose of vaccine in this last week. And just in the first week of having vaccine available in Chicago, we've already seen more than 2,000 little ones in that 6 months to under 5 age group choose to get vaccinated. We've seen about half of the families choose Moderna and about half choose Pfizer. And that's great. We want there to be choice. The safety data on these vaccines is Excellent. More than 12 billion COVID-19 vaccines have now been given around the world. I mean, that's amazing, 12 billion. And the doses of vaccines that we used for the littlest Chicagoans are quite a bit lower even than what we would give for a teenager. So for example, the Pfizer dose for the youngest age group is only 1/10 as much of the vaccine product as an adult would get. These are vaccines that have been designed for the youngest children. They're safe for the youngest children, and importantly, they're effective for helping prevent against severe illness, preventing against long COVID, and helping to stop the spread of COVID. So I strongly encourage all of you, if you know someone who's been waiting more than a year because they're under 5 to get that COVID vaccine, widely available here in Chicago. The city is standing up our larger vaccine clinics at city colleges all the way through every Saturday through early September. Free. We have Moderna and Pfizer available. And we've got the Child Life and the capes and all of the other things that we know how to work with your families. And we know that young kids like my nephew care the most about the type of Band-Aid that they get. And so we're prepared to really support your families in getting vaccinated. Please take the opportunity, if you've got a little one who is now eligible for a COVID vaccine, take the opportunity to get everybody else in the family up to date with vaccines. If you got your COVID vaccines in the year 2021, you should have had 3 doses of vaccine by now, meaning you should have had a booster. And if you're over 50 or you've got moderate or severe immunocompromise, actually you should have had 4 by now. So if anybody, especially if they're older or has underlying conditions, hasn't gotten that booster, we'd like nothing better than to bring it to your house, to have you come to a clinic, to work with your provider, to come to trusted spaces like this and work with community partners, because we just want to protect Chicago. We want to put COVID behind us as much as we possibly can. And with that, I'm really pleased to bring up Sarah Burgess Burnett. She's a Deputy Commissioner with the Chicago Department of Family and Support Services, does a lot of the early childhood education and support work for the city of Chicago.
Good afternoon, everyone. Thank you, Dr. Robinson, for having us today, and also thank you, Dr. Arwady, for all of your leadership through all of the challenges through the pandemic. My name is Sarah Burgess Burnett, and I'm the Deputy Commissioner of the Children's Services Division for the Department of Family and Support Services. We manage a comprehensive network of child care centers across the city of Chicago. We've got about 99 community-based organizations serving over 14,000 children from 0 to the age of 5. This is why this is so important to us today. Through this work, we know that investing in our youngest children, it pays off. Research has already shown us that early childhood education is one of the most effective ways to ensure that children are ready for kindergarten and for the long term. In fact, we understand that children who have early learning experiences, who attend high-quality early learning programs, are more prepared to succeed in life all the way through 3rd grade, and we know it will persist through high school and lifelong learning. We work hard at DFSS to ensure that every parent in the city of Chicago is able to find a safe, healthy, and high-quality early learning experience for their youngest child. And to that end, today, this is so important and such an important step for our youngest community. We have navigated COVID-19 with our youngest learners who face many challenges in their educational and social-emotional lives. But today, we move forward one step closer to ensuring educational success and the health of our youngest children. The pandemic has caused serious disruptions in the stability of our early learning programming. Parents have expressed their concerns over the safety of having their children in environments due to the possibility of transmission of COVID. Positive COVID cases, when they have resulted in classrooms, those classrooms have had to be closed. What we know from that is these closures have impacted every single child, every single parent, and every single family within our environment. And so across the city, our early learning programs have had to deal with the impact of COVID both directly and indirectly. It's not just the COVID infection that affects a young child, but the disruption of their early learning and socialization opportunities due to these closures. Ultimately, these disruptions can cause long-lasting impacts in the social-emotional development of our youngest learners. That's why these guidelines, these updates, this vaccine being available now for our youngest learners are so very important. The new vaccine efforts for our youngest learners will protect them both from COVID, but what it will also do is it will eliminate or minimize the constant disruption that we've seen in their education and social-emotional development. DFSS is now working directly with CDPH and our early learning partners to ensure that we build a system that promotes vaccine events for children under the age of 5 across the city of Chicago. Already we have 7 partner agencies that have set 12 sites across the city that have already volunteered their services to host vaccine events. And we expect these numbers will grow over the next few weeks. Thanks to the perseverance of both the medical community and our child care providers, we will be able to rebuild the sense of safety and the confidence in our programming, encouraging parents to return and enroll their children in these quality early learning opportunities. I thank you again, Dr. Arwady. I thank you, Dr. Robinson and Blue Cross Blue Shield of Illinois, and we look forward to making this progress in this vaccine efforts and continuing to achieve our goal of ensuring that families have access to safe early learning opportunities that we know promotes lifelong learning. Thank you.
You've heard from a lot of partners, and we're going to bring up one more. I'm so pleased to welcome Joyce Chapman from the Healthy Chicago Equity Zone Far South region. Phalanx has been an absolutely stalwart partner of CDPH throughout our vaccination campaigns, and they're just one of 6 regional leads across the city. We get this vaccination work done through partnership with Blue Cross Blue Shield, partnership with healthcare providers, and then partnership with community-based organizations and other government partners. So I'm really pleased to welcome Joyce Chapman.
Good afternoon, everyone. My name is Joyce Chapman. I am the Far South Chicago lead coordinator for the Healthy Chicago Equity Zone for Chicago Department of Public Health under the guise of Phalanx Family Services. We have our team here, so you see these colorful shirts. We're just trying to impress you. But today we were out in the community because this is election day, and we wanted to pass out information as people's coming to the polls and what have you. So that being said is that, like Dr. Arwady stated, we're one of the 6 regions. There's 6 regions, 1 city, and we're going to make it work as we give that information and meet the community where they're at, as we bring that wealth of information and encourage the parents and families to receive the shots. So for the past year, we have been on the Far South side for a long time with 11 community partners. And they are so enthusiastic. They really want to engage their communities on how can we get the information out to the people, to the community residents, that we come and receive the shot. We have tremendous results. Now, mind you, there are people who say, oh no, I don't want it. Oh no, it's gonna kill me. Oh no, oh no. But we get it. So we said we'll give them the information, let them make the determination, and sometime, it might be a month later, we're back out, and they say, I'm ready for the shot. They're ready for the shot. Now we're dealing with the 5 and under. Now, too bad I don't have any more grandchildren 5 and under. I would have been the first grandmother with my daughters to let my grandchildren receive the shot. However, that being said, we are still engaging in the schools, in the preschools, provide information that they can make their self-determination on the right choices, put the shot in the arm. So with that, I will conclude, and I thank you so much. Joyce Chapman.
All right. And so just to complete it out here, if anybody has questions about how to get your child under 5 or anybody else vaccinated in the city of Chicago, 7 days a week, you can call 312-746-4835. And we're connected to what Chicago Public Schools is doing. We're connected to what all of the various healthcare partners are doing. There are more than 200 locations across this city that have accepted pediatric COVID vaccine and want nothing more than to help protect you and our littlest Chicagoans. So,
do we have any questions from the media, or? I guess you covered everything.
All right, so thank you, and let's keep vaccinating. Thanks.
We do have an opportunity to video a family that's having their young child.